And we are told the 22-year-old shot and killed yesterday was living with his parents at the time.
His parents were the ones who called police about the suicide threat, but they also told officers Ryan Coons had used a mind-altering drug and had access to a gun. News Channel 15's Adam Widener spoke with a local psychiatrist today. So Adam, what did he have to say?
Well, the psychiatrist couldn't speak to this case specifically, but told me some aspects of the case appear similar to a growing trend. Young people living with their parents, suffering from depression, and on some form of drug. An issue that turns fatal when a gun is added to the mix.
Patient sits there.
Dr. Jay Favre has seen a growing problem with mental health.
I think the growing issue that we're seeing right now are the young adults who are experiencing depression and using more liberally substances such as marijuana, using alcohol, they're using spice.
On Thursday, police say 22-year-old Ryan Coons' parents called, saying he was suicidal, had access to a gun, and threatened to, quote, blow other people away. That was just minutes before he's said to have started a shootout with FWPD, ending when he was shot and killed. Although it's unclear if Coons had been clinically diagnosed with a mental illness, Police Chief Rusty York called him an unstable individual. And Dr. Favre says substance abuse commonly leads to these sort of actions.
So basically, they're further dampening your ability to control your impulses when you already have difficulty with that due to depression.
Police had responded to Coons' home on a suicide call in the past, and in the end, Dr. Favre thinks someone with Coons' background should not have had access to a gun.
A vast majority of the patients I see as a psychiatrist have every right in the world to have a gun permit and have a gun on their possession. But a few people who have a past history of violence, a few people who are currently suicidal, or a few people who are currently threatening another individual, those people shouldn't have any weapons in their possession. They should not have access to guns.
If you or a loved one is struggling with a mental health issue, the doctor gave me 3 places for you to call. You can call a community mental health center, primary physician, and of course, if it is an emergency, you can call 911.
Adam Widener, thank you.